Hi, and welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different procedures. First up, we're going to be talking about gynecomastia, followed by tummy tucks, then eyelid lifts, and finally, otoplasty.
Ooh, all the big words.
I like that, yes. And before we get started, any advice we give you today, remember, consult your own physician first. Let's jump right in. Happy holidays, Dr. Mealy.
Thank you, nice to be here.
We
nice
love
to be
you,
back at
our
Cron.
viewers, yes, and our viewers love you, and so it's always fun to have you here. So let's jump right into it. The holidays are around the corner, right? People are always rushing in, maybe to get some last-minute plastic surgery. Am I right about that?
Well, yeah, and also it's a time when we have time.
That's
so
true.
A lot of
Good
folks
point.
have the time off. We're not out running around in the sun. Good time to recover.
That's right.
So it works.
So let's talk about gynecomastia. First off, what is it? If somebody doesn't know what gynecomastia is, what is gynecomastia?
Sure. So gynecomastia is development of breast tissue in men.
Oh, okay.
So men, we like to have flatter chests. So if we
Right.
develop a lump there, there's a way to get rid of it.
And can testosterone cure gynecomastia? Because there's a lot of men that take testosterone, or they can be on, supplements or something like that. Can that help?
No, it can hurt.
Oh, it can?
Some of the supplements, like what we use for anabolic steroids and such, can cause more development.
Oh, I didn't know that.
And it may not always be the level of the testosterone. About 2/3 of men get some gynecomastia when they go
Really?
through adolescence.
All right.
And it's not that the levels are wrong, it's just that the tissue is more sensitive to those levels.
And how do you tell if it's gynecomastia or just fat?
Fat usually comes with additional weight gain.
Oh, okay.
So I'll have patients who are very thin that just have fullness in their chest.
Gotcha.
The tissue tends to be more firm.
Okay.
So it feels harder, sometimes
If it's
even rubbery.
gynecomastia.
If it's gynecomastia. Whereas the fat tends to feel softer.
All right, let's go to the pictures because people like the
Sure.
before and afters for sure. First one.
So this is an example of someone with fullness, mostly from
Yeah.
fat, though it can also be a glandular component in there.
So it can be a little hard, and it can also just be a combination with
It
some
can.
fat in there.
If it all
That is
feels
beautiful.
smooth, then it's usually just fat. If there's a little lump in there, sometimes there's a little golf ball sized lump in
Yeah.
there. That's mostly
Just take
glandular
that
tissue.
out.
So in this type of case, what I do is liposuction first. So
Okay.
I'll make a small incision up in the axilla, in the armpit.
Okay.
So it's hidden.
Oh, okay.
Suction out everything I can. If there's some glandular tissue left, then we make a little incision from 4 to 8 o'clock around the areola, the colored part around the nipple.
Right.
And take out the hard stuff.
So
And
no,
it makes it nice and smooth.
and no scars at all because it's under
There's
the arm.
scars. There's a little scar underneath the arm. It's about 3/8 of an inch, half
That's
an inch.
it.
And then underneath the nipple runs around from 4 to 8 o'clock.
Picture number 2 while I ask, what's the downtime?
Sure. So downtime for this, it's a couple weeks before you can do heavy lifting, that sort of stuff.
Okay.
Most people, it's sort of like a lot of push-ups for a couple days.
Gotcha.
By the end of the week, usually feeling fine. I do have folks wear a vest, a little compression vest
Oh,
that
okay.
keeps it flat and smooth.
Like that.
And that we wear kind of day and night for 2 weeks, and then half the time after that for another month.
All right, second picture.
So with the gynecomastia, we're always looking at the areola too. So I'm not sure if this was the second or that was the second. Well, we have one guy with the fullness underneath the nipples.
Yes.
Often when we take the tissue away, it shrinks.
Oh, okay.
So as it shrinks, it looks smaller, look a little bit darker too.
It looks like you actually changed the nipple, but you didn't.
In this case, I didn't, and that's why I was looking at the
That's-
2 pictures.
yeah.
So the next one I do.
Gotcha.
So in this
okay.
case, it just shrank, and
So
usually
this
there's
one
a
shrank.
hint that it'll shrink
Gotcha.
because the skin is thin, the stuffing underneath is very firm.
Gotcha.
And you know as you take that away, it's gonna shrink wrap.
That's a beautiful job. You can't see any scars, and it's all done very flat. And what about the picture, the next
So
picture?
the next person actually has a little bit of sagging already. The nipple is big, but it's also loose. So
Gotcha.
in those cases, I do need to reduce it. And this is a fairly early picture, so you can see that there's a scar, a little bit of redness around the areola afterwards. What I've done is remove sort of a donut, the outer layer of the areola, so that what's left is smaller,
nice.
and then bring the skin in to match.
It's a beautiful job.
And also we've removed this tissue from behind the nipple, of course.
Now, when men come in, what are the symptoms that men come in for and say, hey, I have to get this done? Because a lot of men don't, they don't
Sure.
want to admit there's a problem or anything. So
Well,
why?
sometimes it's just the fullness, and it may not be just without a shirt. It may be in a shirt, in a tight
Yeah.
shirt. It looks too full. They're embarrassed by it. They're concerned with the way that it looks. It inhibits them from wearing certain clothing. Other times it's tender.
Oh, okay.
So just like women's breasts get a little tender with menses,
Yeah.
sometimes with gynecomastia it gets a little tender, and it's worth getting rid of.
Yeah, absolutely. Next picture here.
So this is a guy also mostly just sort of a smooth, diffuse fullness,
Right.
not a lump underneath the nipple areola. And a lot of times in these cases, if we just do liposuction, it helps. But again, if there's that glandular component, then we'll sneak in there just around the nipple and take it out.
And it looks like there was here because it's a little harder
Yes.
than just fat.
It's a little harder. Yep.
Gotcha. You can really tell that. I mean, that's
And
a
it's
big
usually
difference.
the lower part of the chest.
And very natural. I mean, it looks so great. The after picture looks like nothing was done.
Well, my goal is always to do as little as I need to make it better.
Looks
So the
fantastic.
smaller hammer that's going to work is the right hammer.
And I like this last picture here.
So this guy looks like a superhero. I mean, he's got
He looks like
unbelievable
the Hulk.
definition. He's very strong. He works out.
Yeah, why would he need it?
Exactly.
You know, you work out, you strengthen that area, so why do you need
If
it?
the world were a fair place, he wouldn't.
Yes.
But if you look at the left breast, he's got some breast tissue. He's got some gynecomastia in there.
And that's it, just
So
the
he's
left
got
one.
asymmetry. Yeah, it's his left breast, so it's on our right side. But you can see there's asymmetry. So
Oh,
what I've done
wow,
is just
that's
take out tissue
amazing.
on the left side to make it match the other side.
Ken from Marin County, I've got an email question here. Wants to know if gynecomastia returns after you do all this.
It's unusual to have it come back.
Really?
Because we're removing so much
Good.
tissue, there's a little bit of tissue left behind. It's unusual for that to get big enough to bother.
And a quick question, do you put people under for gynecomastia? Is it?
Usually I do, unless it's a small area under the nipple areola,
Okay.
then we can do it under local. But
Excellent.
for most patients, if I'm doing lipo, a bigger area, I definitely want to make sure they're comfortable.
Well, you did a great job on this guy because it looks very natural, and he's back to being the Hulk there, and he just had that little tiny
No
area
worries.
taken out.
They can wear his tight shirts and feel good.
It's great. I love that. All right. For more information about Dr. Mealy, you can call the office at 925-943-6353 or check him out on the web at either drmealy.com or sanfranciscobreast.com. And you can see all the before and after pictures there. We'll be right back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.